Hi, welcome to Love Your Lady Parts. My name is Erin Gattuso. I'm a naturopathic doctor and I work at Turnpole Health and Wellness. And this is Carly Gossard.
Hey, I'm Carly. I'm a pelvic PT. I have a concierge women's health physical therapy business based out of Northern New Jersey. I specialize in orthopedics and pelvic floor. And together we're bringing you this series to talk all things women's health, sexual health, pregnancy, postpartum, hormonal changes. And we have a confession. Erin, take it away.
Okay, our confession is that we actually know each other from college, which is really fun to think about us as college kids and then now us as professionals. But it's funny that we both have the same passion for pelvic health. And so whenever we talk and catch up on the phone, half the time our conversations turn into these topics. And so we thought it'd be really fun just to bring you into that conversation and share both of our expertise.
I love you so much. My confession was that, so we had week one yesterday, we had our webinar series, we had a great turnout, and halfway through, Erin's like, oh, and we're gonna send you the recording of the video, and I was like, we never pushed the record button. So here we are, we're making sure you get your content and your resources and your information, and next time we'll be sure to hit the button, but here we go.
Here we go, okay.
So topics for today and objectives for today. We're talking about pelvic floor physical therapy. I think a lot of people don't know that it exists, what it is, what it entails, what to expect. We're going to talk about a lot of common infections, yeast infections, bacterial vaginosis, chronic and recurrent UTIs, urinary tract infections. We're going to get into the topic of painful sex, why it happens, what we can do to treat it, emotional aspects of it. We have to touch on trauma. So we'll be saving that for the end. And then obviously in the live series, we always save like 15 to 20 minutes at the end for any questions, conversation. And we had some really great participation yesterday. We had some really great questions at the end. And then we tweaked the PowerPoint a little bit to make sure that you had all resources, pelvic floor directories, different YouTube videos and different tools for home. Okay, so as I said, I'm a pelvic floor physical therapist. And how is pelvic floor PT different than regular PT? You think of rotator cuff tears, painful knees, running injuries, broken bones. Pelvic floor PT is the specialty focusing on all things pee, poop, sex, postpartum, menopause. Males have pelvic floor and they need treatment. Children can have pelvic floor dysfunction. Think at any age, if we lose urine, coughing, sneezing, laughing, running, losing urine without your control at any age is not normal. We treat constipation. We see pregnancy pain, sciatica, symptoms that can develop while you're growing baby. We see postpartum diagnoses such as maybe prolapse, the descent of the organs, diastasis recti, the split of the rectus bellies. So anything in your torso or your pelvis, we treat, we see. The pelvic floor, you can see these pictures on the side. The top one is a bird's eye view looking down with the spine behind. And the bottom one is like as if you're looking up and in. And I also have Patricia the pelvis here, my little model. So as you can see, it's a bowl of muscles that sits at the bottom of your pelvis. Okay, so your hips are coming out here. This is your pelvis and your lumbar spine and your sacrum. Okay, so we have this bowl of muscles at the bottom of your pelvis, and it acts to support your organs. So within this pelvic cavity, we have your rectum behind, your uterus in the middle, assuming you didn't have a hysterectomy, and your bladder in the front. Okay, so it supports those organs. It gives us sphincter control so that we're not losing feces or urine, right? If, with activity or, when we're not ready to go to the bathroom. It's a big stabilizer. So the pelvic floor is actually a deep core muscle. We'll get into that into the next slide. But it gives us a lot of stability for our spine. So we had talked about in my orthopedic practice, you see these low back patients that sometimes don't improve with typical physical therapy and they're not really getting better. And once I started doing my pelvic floor training, I was like, oh my gosh, this was the missing link the whole time. Because we know that the pelvic floor and any dysfunction of how it's working can refer into the hips, groin, thighs, back. And then the last function is sexual function, sexual pleasure. We can have trigger points in these muscles just like anywhere else in the body, and they can cause pain or difficulty orgasming. These muscles have to be able to contract and squeeze, but then also drop and lengthen. And 9 times out of 10, when I have a patient coming in for pelvic floor PT, the more difficult thing to learn is how to relax and to drop your pelvic floor. So everyone thinks they're coming into pelvic PT to do Kegels and to learn how to strengthen up. 9 times out of 10, it's just the opposite. We have to learn how to drop, how to relax, how to bulge and bear down. We need that motion for emptying our bowels, for having a baby, for having an orgasm. It's almost like this. Imagine you're trying to poop and you think that you're relaxing the pelvic floor, but you're really squeezing. It's almost like you're trying to push the stool out of the king toes, and it kind of creates this cyclic cycle of constipation. So that's something that we treat, is the motor control of these muscles here. Usually not something that we have to think about until it gives us a problem. And then you find us. So
and on that, I also just want to note that, like, from a practitioner standpoint, so many people come in with chronic constipation, and we have like the things that we do, you know, like the protocols that we follow. And there are times whenever we do everything right, we do a stool test, we do everything, and they're still not getting to their constipation. They're still struggling with that. And now it's in my head, okay, well, when that happens, maybe we need to be referring to a pelvic floor physical therapist, which really, that wasn't really on my radar, but it makes so much sense. Like, why would we not address structure whenever?
Yeah. And muscle motor control and function, because we're always thinking, like pelvic floor PTs, we're always thinking, okay, what's your fiber look like? Do you have a good percentage of soluble versus insoluble? How's your water intake? How is this affecting your bowels, your stool? Then there's always the aspect of, do I need to send you out for stool sampling? Is there an active infection? But you're totally right. Sometimes we have these patients where there's no findings from swabs or samples, and we're like, well, what's going on? Sometimes people come in my office, they're like, I can't believe I have to learn how to poop. And, you know, it's the same idea as birth prep, just learning how to relax and bulge those muscles, getting yourself into a good position to empty your bowels. We love good poops. I mean, it's so important so that we're not.
So do we. So, as naturopaths.
Say that again?
I said, so do we as functional medicine
practitioners. Oh, yeah. Oh, yeah.
We like good poops. So.
Yeah, exactly. So pelvic floor is a deep core stabilizer. It also has to act as a trampoline, okay? So it has to have some give and take. If you don't have that range of motion, relaxing or going down, and imagine you're running, we can't just have those organs bumping on a hard surface and having nowhere to go. It's got to have some ebb and flow, right? So it does need that range of motion, needs that motor control to lengthen. I went over what we treat, and then what can you expect from a pelvic floor eval. I have concerns sometimes when a patient comes to me and they say, oh, I've tried pelvic floor PT before, it didn't work for me. And I'm like, okay, what did you do? And maybe they did core exercises, breath work, postural education. Maybe they did all the education on bowel bladder habits, how to maybe give yourself some better leverage for emptying your bladder and your bowels. Maybe they went on biofeedback machine, which is a machine that just measures your action potential of your muscles. They can do internal probes. But gold standard for assessing these muscles within the bowl of the pelvic floor is an internal exam. This is the best tool that I have because I can feel for tone, trigger points. I can feel for your coordination, your strength, so true muscle strength testing. If you came in, Erin, for your shoulder and you're like, ooh, something's really hurting me, I'm gonna feel for how you move it actively, for your range of motion. I'm gonna feel what muscle is the culprit, like where is that pain coming from? I have an amazing mentor in pelvic floor world, and I'll never forget, she said, normal muscles don't hurt. So just like you touch any other muscle in your body, your traps, your biceps, what have you, it shouldn't elicit pain. So pelvic floor muscles are the same. So when we're doing an internal exam, and patients are like, ooh, I feel that into my back, or ooh, that doesn't feel so comfortable, that's not a normal response to light touch. So that's something that we have to address and kind of lengthen those tissues, because we have to lengthen before we can strengthen. If we have tight, irritated, guarded pelvic floor muscles with trigger points, and we're just kegling, kegling, kegling. If I have a biceps contracture here, why am I going to just keep doing this? We have to lengthen and relax everything, get that full range of motion, and then we can re-strengthen. So gold standard is an internal exam for women. Typically, we can just work vaginally. Sometimes rectal is warranted. For my guys out there, rectal is the only option. So there's that. Before we move on, I also just wanted to note two things. We understand that for the sake of this conversation of painful sex, we welcome all ages, races, genders, sexual identities, the LGBTQ community. So we understand that sex is not always man, women, penis, vagina. It can be self-play. It can be female, female. It can be toys. It can be male, male. So that's something that we want to acknowledge as well. Okay. So when we talk about the deep core muscles, we talk about the core four. So the pelvic floor doesn't work alone. We have the diaphragm up top, which is your breathing muscle. And think of it as like an umbrella that sits underneath your ribs. Okay. As you inhale, your diaphragm is going to descend. Your belly should extend a little bit. Okay. And what happens is, if you look at any child who's 2-3 years or younger, we innately start breathing from our diaphragm. That's how we should ideally breathe throughout the day. I think a lot of us find ourselves breathing with our accessory muscles and with our trap to physically lift our rib cage up. So it's coming from up here instead of working that diaphragm and breathing from your belly. So that's why so many of these guided meditations, yoga practice is so excellent for pelvic floor therapy as well, because we talk about the relationship of the diaphragm and the pelvic floor as a piston in a car. I don't know that much about it. I don't know really anything about cars, but a piston moves like this, okay? So as you inhale from the diaphragm and your diaphragm is descending down, it creates pressure in your intra-abdominal region and gives a little downward stretch of your pelvic floor and gives it that normal stretch throughout the day, okay? And if we're not breathing from our diaphragm and we're breathing from our traps up here, and this is staying kind of stagnant, you can see how the pelvic floor isn't going to get that normal bounce and stretch throughout the day. Okay, so those are two big core muscles. We also have the tiny little stabilizing muscles in the back that play a role and support us posteriorly. And then we want to, everyone thinks about the rectus, right? Your six-pack muscle right in the front. But our deepest core muscle is our transversus abdominis, and it's kind of like that corset wrapping around. Think Rose from Titanic sucking into that girdle. And it is hardwired to the pelvic floor. So if you contract one, you're contracting the other without really knowing it. So we want them to be coordinated. We want them to be strong. We want to build that support from those deep core layers to support your back and to, correct your breathing and to make sure that that pelvic floor is getting some normal contract and release throughout the day. Something else that pelvic floor therapists also focus on is how the organs are moving. So we call this visceral mobilization. So we have motility within one organ. So some people will say, well, I have, slow digestion. My GI, it just takes me a while to work through and to digest something. So that's motility within an organ. So sometimes we can do manual work to coax that GI to pass stool, which is good if you're blocked up. But as far as visceral mobility, we're thinking of the relationships of those pelvic organs in that cavity, okay? So something we find, my C-section mamas come in and they're like, well, my pelvic floor should be fine. I didn't have a vaginal birth, but you had a big scar right in front of your pubic bone. And we know that the body likes to hug scars and move towards them, right? So if everything's pulling forward a little bit, and the bladder has less room to move, and then the uterus is kind of like it doesn't have its space that it needs. Or maybe you had a hysterectomy and now there's empty space where the uterus used to be, okay? So we're looking at how those organs are moving in relation to each other, because every tissue in the body, muscles, ligaments, tendons, joints, bones, organs, everything has to have space and move and glide. So how we do this is just working into the abdomen, feeling those different structures and making sure that there's no restriction there.
Can I add something to that too? So I actually do visceral manipulation in my practice as well. And this is just one of my favorite modalities. You can tell a lot about someone's abdomen just with your hands. But you know, whenever I went through the courses and the training for it, I learned that, you know, if you were to take an ultrasound and just keep it focused on a uterus for a long period of time, for like a couple hours, you could actually see the uterus just like contracting ever so slightly all the time, constantly. And this is like in this like really pulse-like fashion. And this is something that I didn't really have awareness of. Of course, we know that, you know, our digestive system moves, and it moves like food through it, but all of our organs have like this tonic movement. And so making sure that that motility is working within that organ is I think, I want to say like an untapped diagnostic measurement that we don't really use in medicine anymore. And probably traditionally they used a lot more. So I just thought that was a unique thing.
Yeah. And so, I mean, just talking about urinary frequency urgency, that's usually like bladder control after having babies or after menopause starts to hit, or really at any age. The bladder, you do not have control over. It's smooth muscle. So what happens is that urine is filtering in and just stretches. Once it stretches to a certain point, it gives you that signal, ooh, I have to go empty my bladder. So you can imagine if the bladder isn't able to move, right, and it's not really like, it doesn't have that space to fill, it's getting that signal a little bit sooner. Whereas once you kind of give it some room, give me some space. Once you give it some space and it's not getting inappropriate stimuli, right? Nothing's telling it, oh, I think you're stretching, you have to go to the bathroom soon. We can get those symptoms under control much easier.
Right. So interesting.
So the big topic today, dyspareunia, painful sex. We discussed that sex is very individual. So you may have different goals, different practices, and this is something that you should discuss or that your pelvic floor physical therapist should bring up with you. What are your goals? Is it penis and vagina? Is it you know, toys or yourself? So that's, you know, something that we take into consideration. We talked about how the pelvic, go ahead.
I wanted to, just before we get into this, I want to say this is a lot more common than people realize. I don't think that we talk about it individually with each other. And it's almost, it can be almost like a shameful thing that people don't really mention. And which I think is kind of a shame, because when you kind of normalize something, it makes it easier to work through it. So I just wanted to mention that and maybe get your thoughts on that as well.
Yeah, we always have the conversation of common but not normal. So yes, it's common to have painful sex. You may talk to friends who are like, oh yeah, it hurt me too. And we have this conversation and we just accept it. We're like, okay, I guess that's just me and my anatomy, my vagina, how it's going to feel for me. And that's not the case. Bottom line is sex should never hurt. It should never hurt. So if it is, we have to get to the root of why. Is it something, is there an infection? Is it your muscles? Is it lubrication? Okay, so talking about lube, there is no shame in using lube at any age, any stage. It's, we relate it really to estrogen levels. So we're always looking at where you're at in your cycle, in your life. So if you just had a baby and you're breastfeeding, your estrogen is going to be lower. Estrogen is the hormone that bulks up our tissues, makes them nice and strong, and also gives us that natural relaxation, or the lubrication, I'm sorry. So the immediate postpartum phase, think about a stressful time, and then also returning to sexual activities with your husband once you've healed from delivery, or your partner after delivery, and then also menopause when estrogen starts decreasing. You can still be sexually active at that age, and we want to make sure that you have the tools to do so if you're not creating that lubrication. And it doesn't have to be anything fancy. Go into your kitchen cupboard and get any oil, olive oil, avocado oil, coconut oil, and it can be something that's right in the kitchen. We talked about masturbation and self-play. It's hard to communicate to a partner what you need and what feels good for you if you're not so sure about it yourself. So sometimes I literally recommend with patients, I'm like, what do you like? Like, have you explored? Because, you know, it's tough to communicate what you're not sure that you need. So also no shame in self-play and masturbation. And then trauma, which is a complex one. So trauma doesn't always have to be sexual trauma. It can be family, loss, whether it's child, family, a job. We're thinking about that right now. A lot of people, you know, have lost jobs, and that's, you know, that's a source of trauma that the body can hold that can limit our sexual function. So we're getting into that in more detail a little bit later on. But now I think Erin, yes, is getting into infections and the nitty gritty of all the processes going on in the pelvic cavity.
Yeah. So, yeah, it's really hard to enjoy any sort of sexual activity if you feel just uncomfortable down there. And if you have any sort of infection, that definitely plays into it. And, you know, I can't tell you how many people I hear say, oh, every single time I have sex, I end up getting a UTI. Or then I take antibiotics and then I get a yeast infection, and there's this really nasty cycle. And it can really not just, be uncomfortable in the moment, but it can really add to anxiety around having any sort of like sexual encounter, for sure. I do want to say, like, if you do have something going on down there, this is not diagnostic, and you really do need to go see somebody to make sure you know what it is. I'm not going to touch on necessarily like the signs and symptoms of any of these infections, because I think that it's just really important to see someone who's trained and who can do the proper lab work. And also, I'm not really going to touch on STIs all that much, because I'm really, whenever it comes to STIs, you want antibiotics. So I'm a naturopathic doctor. For me to say you want antibiotics for those things, I really mean it. There's just some things you don't want to mess with, and that's one of them. And really what I want you to get from this talk today is prevention, and also how do you, if reoccurrence and chronic infections are something that you deal with, how can you actually build up your own immunity and your ability to fight those things so that you don't have to deal with that long term. Because I love, for certain things, antibiotics are helpful, but long term, they're not the best option. Oh, we need to actually switch the sharing.
Oh, yeah. No, stop it.
Bear with us for 1 second. Okay. Let's see. So the first thing you want to really think about is vaginal pH. And so our vaginal pH is usually anywhere between 3.8 and 4.5. That is an acidic environment. This is really important, specifically because a lot of soaps that we use, like soaps across the board, are very basic. They're alkaline. And so right from the start, that's something that you can really assess is if you're using soap in those areas, there's a very good chance that you're influencing your pH for the worst. And so just as far as like hygiene goes, that's really important. This is also really important because our pH actually changes throughout our cycle. So estrogen actually acidifies the vaginal cavity, and it pre-ovulation, as your estrogen is rising, the acidity in the vagina is also rising. And then at ovulation, it peaks and then it drops. And then you see the pH change to be more basic or closer to neutral, I should say, because it's still more acidic. And this is really smart because sperm cannot swim in and survive in an acidic environment. And so your body is intelligent and it knows, okay, we need, if we're going to actually achieve fertility, if that's the goal, we're going to drop the pH and so that we can allow the sperm to get to their destination. But this is also why we see certain infections in a cyclic manner. So it's not uncommon to hear people say, oh, around ovulation, I get bacterial vaginosis, and after my menstrual cycle, I have a yeast infection. And it's kind of like a lose-lose situation. As they're getting over one, they're seeming to get another. So This is just something to be aware of. Our best friend, whenever it comes to keeping the vagina nice and acidic, is Lactobacilli. So Lactobacilli are probiotics. They're the main ones that you would find in yogurt, in certain sauerkrauts, in most probiotic supplements. And so they keep not only your vagina nice and acidic, but they also release antimicrobial substances and hydrogen peroxide. And so they keep everything happy down there. One thing that we often, like a common suggestion that I make to women who consistently have infections is actually to, actually, this might be on the next slide. One thing that I commonly tell people is to actually put the probiotics in intravaginally. And so most probiotics, if they have like a cellulose capsule, they will dissolve, and you can almost use them like a, oh gosh, what's it called whenever, suppository, that's what I'm looking for. So you can almost use it like a suppository, but you also want to take it internally as well. So that's something you can do if you have chronic, bacterial imbalances. This is really important whenever it comes to any chronic use of antibiotics. So antibiotics are definitely the main thing that kills lactobacilli and sets you up for yeast infections and other things like that. So you want to remember, if you're taking antibiotics, that you also take probiotics, just at a different time, pretty much consistently. Other things that really disrupt lactobacilli are antifungals, any sort of steroids. Birth control can also change the pH and change the bacterial of the vaginal canal. So some people will only have infections whenever they're on birth control, which is kind of interesting. Spermicides can, and also you just want to think about your overall immunity. If your immune system is low, your ability to fight infections is pretty low.
Two things.
Sure.
Yeah, so going back to hygiene, same mentor described the vagina, excuse me, as the self-cleaning oven. So the soaps, the douches, all that, she goes, honestly, water and your hand in the shower, that's it. Self-cleaning oven, let it do its thing, because you don't want to mess with the pH, exactly as Erin said.
I'll say that's true most of the time for most people, though there are certain like high pH soaps that actually a lot of people do get relief from. So I don't have any of their brands, but I know that I've had that feedback from a lot of people. So I think that's true most of the time. Like, you would definitely never use normal soap, but I think if you have specific like vaginal soap, like there can be exceptions to that.
Perfect, thank you.
Yeah.
And then as far as the antibiotics, just in my practice, what I see is sometimes we have these patients who are coming in and they're like, I've done six rounds of antibiotics, and sometimes in the absence of finding any present disease or infection.
Right.
So like we talked about, when you take those antibiotics and it's wiping the good bacteria that you have in your body, especially if you're not supplementing with probiotics, it can turn into this like vicious cycle of, okay, I'm getting relief while I'm on the antibiotics, maybe a week, and then it's starting to come back because I don't have my security guards. I don't have that good bacteria to protect me. So something to think about. Right.
No, absolutely. And that kind of gets into the next one, urinary tract infections. So a chronic urinary tract infections are anytime you've had more than 3 infections in a year or 2 in 6 months. And the main reason for this is either it's unresolved, which means that after you take antibiotics, either because you had antibiotic resistance, which happens faster than we like it to, or because the E. coli can actually, so E. coli is the main pathogen that causes urinary tract infection. So the E. coli makes this thing called biofilm. So biofilm is like this like slimy, sticky substance that your body can make, and basically the E. coli can hide in there. And if there's a biofilm, then it makes it harder to address with antibiotics. And the other reason, so either, the infection never went away fully, or there's a reinfection, and that's because all your good guys, your lactobacilli, are wiped out, and so an infection can just walk right in. The other thing I will say is that your gut microbiome is really closely linked to your vaginal and urinary tract microbiome. And so if you have like IBS or consistent bowel issues, you are much more prone to getting urinary tract infections. Perhaps that's because there's more E. coli in your gut. That's highly probable. Or maybe your immune system is more compromised. So yeah, and the other things you want to really think about are drinking a ton of water. So the more concentrated your urine, the easier it is for the E. coli to proliferate. So that's
interesting, because you would think it would just be acidic and irritating, but the E. coli thrives in that environment, you're saying.
Right, exactly. You want to think, I mentioned immune function already. And also if you have high blood sugar. So if your blood sugar is consistently high, a little bit of insulin resistance, then it basically feeds the E. coli and makes it a lot easier for them to grow. The other thing I don't have on here is estrogen. So if your estrogen is low, that disrupts the integrity of your, basically your barriers, your mucous membranes a little bit. And so that also makes it easier for urinary tract infections to happen.
So estrogen, the muscle bulker, the lubricator, it makes that film. We like estrogen at appropriate levels, right? And then a couple more things from a PT standpoint. We always ask about, say you're coming in for urinary frequency or recurrent UTIs, and we know that feeling. It's like that burning. I have to go to the bathroom, but it hurts, and I only have a dribble that comes out. No matter what, or urinary frequency, you know, without the burning, without the active infection, we're always asking about bowel and bladder, because the bladder is so closely related to the rectum. So you can imagine if you're coming to me and you're like, I always have to pee, I can't hold it, or I'm having pain with sex, and you're constipated, you're not able to get that stool out. Number one, the stool is sitting in there and it's getting dehydrated, so it's harder to pass. Number two, that stool is sitting in there and it's taking up space within this cavity. So the bladder has the less ability to really fill to its full capacity, so you don't have to go as frequently. And then trying to get a tampon, a speculum, a penis, a toy in there, a finger, it could just take up space. So we're always asking those habits in tandem. And then we're also asking about your hydration. So on top of, if you're dehydrated, if the urine is super concentrated and it's attracting all that E. coli, which is leading to the UTIs, we also want to think about the concentration of the urine, because if somebody comes into me and they're like, well, I don't drink that much water because I don't want to have to pee. It's actually counterintuitive, because you're dehydrating yourself. It's getting more concentrated. It's irritating the lining of the bladder, and it's actually going to have to make you go sooner. So we want that pee to be clear, almost clear. And if it's that dark yellow and it's concentrated, we are at higher risk for having that E. coli or having that bladder irritation. So rule of thumb that I usually say is divide your weight in two. That many fluid ounces. So if somebody weighs 100 pounds, I wish 50 fluid ounces throughout the day at least of clear liquids.
Yeah. Thanks for that. So here's just like a couple preventative measures that we talk about for chronic UTIs. So D-mannose is the sugar that you actually find in cranberries, and probably most people have heard, okay, drink cranberry juice for if you have a UTI. That's because of D-mannose. And so D-mannose actually they prevent the attachment of E. coli to the bladder and to the urinary tract. And they are a wonderful prophylactic. So that means, prophylactic means it prevents. So it's not uncommon that people are given antibiotics that they would actually take every time they have sex as a prophylactic measure to make sure they do not get an infection. And they've actually found that D-mannose is just as effective as the leading antibiotic for UTIs at preventing that UTI. So what's nice about taking the D-mannose and not the cranberry juice is that to drink cranberry juice every single day for the rest of your life, that would get really old. But D-mannose is so safe because it's technically only a sugar. that you could take it the rest of your life and really have no repercussions from
And they
it.
also have cranberry pills, right? If you don't want to drink all that, or if you don't want to.
They do have cranberry pills, yeah. But like, you know, I will say I have like this really sweet lady who had UTIs every month for years, and she also had IBS. So it was like this chronic, like, okay, I take antibiotics to fight the UTI, and then it messes up her gut, and she just really couldn't get a handle on it. And I think I only gave her D-mannose, and she didn't have a UTI for a year after that.
That's incredible.
It was incredible.
Wow.
It really was. Like, it was quite life-changing for her. So this one is like a really good one. I just want to really knock that home. So Lactobacilli, rhamnosus, and reuteri are the probiotics that you really want to think about, because those are naturally in both the urinary tract and the vaginal tract. So you just want to make sure that you have a probiotic with those strains in it. Vitamin C helps acidify the urine. So E. coli likes more neutral environments. And so it grows less in acidic, and it actually does grow less in alkaline too. It doesn't like the middle range. So we want to just keep the urine a little bit more acidic. We already talked about estrogen a lot. This is a really fun one because it's summer. So corn silk tea is, if you are husking corn at all this summer, that silk that you take off the top and you usually just throw away, actually take it and freeze it and keep it in the freezer. And next time, if you have a UTI, you can take it out and make a tea out of it. And so this is actually what we call a demulsifier in herbal medicine. And it's very soothing to the urinary tract specifically. And it actually works shockingly well. So that's just kind of like a fun little thing to think about. And the other thing is you can take a lot of teas that are specific for the urinary tract and just kind of drink those chronically or like on a daily basis if you have chronic infections. And so Wise Women Herbals makes a really good tea that I would recommend. Okay, so bacterial vaginosis. This guy is persistent. And it's not technically an STD, but it definitely can get passed from partner to partner at the same time. So the main thing you really want to keep in mind with this one is keeping the vagina more acidic. And so what's hard is that the treatment for this is usually antibiotics, but it has a really, really high reoccurrence rate for people who take antibiotics. And so they've actually found, like there was this really neat study that found that vitamin C tablets that were inserted vaginally cured 55% of people without any recurrence, which is more effective than antibiotics and antifungal treatments. So vitamin C, you kind of want to think about. Another really common one is boric acid that we use. Boric acid is harder to find, but you can find supplements or suppositories with it in. So that's bacterial vaginosis. Yeast. Okay, so yeast grows in normal pH or alkaline or basic pH. So it also comes back to keeping everything nice and acidic. You want to think about, okay, is it just isolated to the vagina, or is it more of a systemic yeast problem? And more oftentimes than not, it's more systemic. And so you can look at their tongue, you can see if they have like a white film. And if there's a little bit of a white film, that, okay, maybe they have some yeast overgrowth. You also, like people who have more systemic yeast, they are always craving carbs. So if you're someone who wakes up in the middle of the night and you're like, I must go to the refrigerator and eat ice cream, is that you, or is that, potentially yeast or other bugs influencing you to do so? So that is kind of something to think about. And overall fatigue and brain fog are really, really common with yeast overgrowth. And so yeast overgrowth is often like not necessarily the root of the issue. It's often almost like a symptom of the issue. And that's because you, don't have the good probiotics to keep the yeast at bay, or B, your immune system is a little bit compromised. And so yeast can grow a little bit more easily. And so the main things you really want to think about still are probiotics, keeping an acidic environment. One thing you can do though is, so apple cider vinegar, like vaginal spray. So like 1 tablespoon to 1 cup water, you just put it in like a little spray bottle thing. And anytime you get out of the shower, you just spray it down there. You would think it would burn, but actually it's quite soothing to the tissues, which is really interesting. And that kind of helps keep things at bay. The other probiotic.
You told me that when I had an infection. It was like life-changing. It was so good, didn't burn, it helped. Oh my God, it was such a relief. Because I thought the same thing. I was like, oh, I think it sounds like painful, but no, that was a lifesaver. That's a really good one.
And it's one of those easy things because everybody, I think, has an apple cider vinegar at home.
Oh, yeah.
And the other probiotic that I want you to remember is Saccharomyces boulardii. And this actually, I misspoke. It's not a probiotic. It's a beneficial yeast. And so this is like good yeast, just like we have good and bad bacteria, we have good and bad yeast. And so Saccharomyces boulardii is the good yeast, and it basically outcompetes Candida albicans.
That's a tough one. Candidiasis albicans?
I swear I know that word. But yes, it outcompetes that. So yeah, just something to keep in mind. The probiotic we have here at Turnpal Health and Wellness is my favorite probiotic because it has a combination of those really good probiotics like Lactobacilli and Bifido, but it also has the Saccharomyces boulardii, which is really uncommon actually in probiotics. And so you're kind of getting a lot for a big bang for your bucks. You know, that place.
Wait, can I ask 2 yeast questions?
Yes, please.
So there's good yeast and bad. So we all have yeast.
Yeah, we all have yeast.
And we want a certain level of it. Once we have that overgrowth is when we start having infection, the itching, the irritation, the coating on the tongue, the cravings.
Right.
So we do have good yeast. And then do you ever recommend to patients, like in addition to the sprays, the topicals, the probiotics, the beneficial yeast, is there anything dietary-wise that people can do that you often recommend for chronic yeast infections if you're more prone?
Absolutely. So decreasing your carbs can absolutely help. So especially any sort of refined sugar, because that just directly feeds.
I think the sugars definitely, right?
Yeah.
Having good carbs, squashes, sweet potatoes. And I don't want to go down a crazy rabbit hole, but what about like gluten?
Well, gluten, so.
We don't have, I just opened up a.
So gluten really can disrupt a lot of people's immune systems in a negative way. And so not only is it often eaten as a refined carb, but it also can really squash your immune system down. And so a lot of people feel better if they go off of it, not just from a yeast perspective, but from an overall health perspective.
Great. Okay.
Yeah.
We could have an entire presentation on, well, I couldn't, but Erin could have an entire presentation on gluten. So moving on.
Okay. Okay. So HSV stands for herpes simplex virus. I also, oh my gosh, this is so common. And I get really upset by the stigma that goes along with it, because for some people it's kind of like, oh my gosh, I have herpes. No one's ever going to love me again. I'm never going to have sex again. And there's so much shame that surrounds it, which shame itself can really disrupt the immune system. So first I want to kind of dispel, this guy is not that bad. And in some ways, if you kind of twist your perspective on it, there's some benefits to it. And that is HSV pops up whenever your immune system is compromised. So basically you can't get away with having a low immune system because your body will start yelling at you. So that forces people to really take charge of their health. And I have to say, this is something that is usually controlled very well with natural medicine. And if we just help boost the immune system, give some lysine, and also take antiviral herbs, and, you know, make sure your D and your A are where they should be, vitamin D, vitamin A. I, knock on wood, have never had someone who we weren't able to control it almost completely. So this is not that big of a deal. If this is a very, very big deal for you, I would definitely go see a functional medicine doctor. Most are fully able to help support you in this manner.
And back with the stress, we know so often that, like, if we have stressful situations, maybe we have breakouts, we feel fatigued, maybe we're more prone to get sick, whether it's a cold or something. We know that stress has a huge relationship to decreased immunity. So if you're in that environment, it's more possible for these symptoms to arise, or HSV to kind of pop its ugly head, right?
Right.
Absolutely.
Yeah. Histamine. So this is something that a lot of people don't really have full awareness of. So if you have symptoms, but you've gone to the doctor, you know, over and over again, and they can't find any form of infection, think, do I have high levels of histamine? So histamine is the chemical that gets released anytime you have an allergic reaction. So anytime even you get, let's say, stung by a bee and everything swells, that is a histamine reaction. And then you're itchy, that's a histamine reaction. If you have seasonal allergies or even food allergies, there's a good chance that you have high levels of histamine. So just like your skin gets itchy, your vulva can also get red and itchy and irritated. And so a really cheap way to, you know, test this out is, you know, take some Benadryl, which is an over-the-counter. You may, okay, technically you should talk to your doctor before doing anything like that. But, you know, take an antihistamine and see, do my symptoms go away? And so Benadryl is not a long-term solution. This is just almost, it's a test ultimately. You need to figure out, you need to look a lot deeper and look at your overall inflammation to help decrease your overall histamine. But yeah, just so that it helps put you in the right direction. And there's a lot we can do naturally for that.
It's a great little tool. I like that.
Pelvic pain. Okay. So this can be a really, really big topic. But one thing I really want to stress is that the pelvic cavity is not sterile. So we have this old myth in medicine that, you know, oh, everything on the outside is not sterile and everything on the inside is sterile. Well, first of all, the pelvic cavity is not fully guarded, I should say, from the outside, because your vagina goes into your uterus, and then your uterus has outlets through fallopian tubes. So that's a kind of a direct access to your pelvic cavity. But they've actually shown now that, I'm going to skip to endometriosis. Endometriosis is a really intense pelvic disorder where basically endometrial cells get up into the pelvic cavity, and there's a lot of different theories as to how that happens or why that happens. And I want to say, you know, I think we're still trying to figure it out.
It's very poorly understood, but we're finding with more awareness that it's almost like 1 in 10 women that have it that are now like, oh my gosh, why were my periods so painful? Why am I having fertility issues? That tissue on the inside, the endometrial tissue, is growing outside, which in itself, we know that that sounds a little bit scary. But then what can that tissue do is it can kink around other organs or restrict or constrict. And
it responds to estrogen still, just like the endometrial lining in your uterus. If it's outside, it still responds to estrogen. So think about that as your, you know, your estrogen goes up, it can actually start basically producing and proliferating blood in a way.
It feeds it, right?
Yeah. And it, like, classically how they diagnose this is they actually have to go in laparoscopically and look around and see if there are endometrial lesions. which look almost muddy. It's like black, chocolatey lesions. And that's actually from blood. So think about that, like it's almost like micro internal bleeding in a way. So it's very, very painful. And it actually impacts, like you said, 1 in 10 women, a lot more people than even we have awareness for. So anyway,
the gold standard for treating it is excision, is taking it out. So there was a time where a lot of people were doing hysterectomies, taking out the uterus, thinking that if they took out the organ where those tissues were growing in the wrong area, that would be it. But they really have to go through and remove all of those cells so that it's not proliferating and spreading and creating these adhesions within the abdomen and the pelvic cavity.
Right. Yeah, absolutely. And so they take out these lesions, but that creates more scar tissue. And for some of these women, that actually ends up causing more pain than they had to begin with. And so it's not an easy condition by any means. But what I wanted to point out about it is there actually a lot of great research is coming out that women who have endometriosis have much, much higher levels of E. coli and staph and other infectious microbes, basically, that are growing inside the pelvic cavity. And they've actually found high levels of those infections in the menstrual blood, which is not something that people have really talked about. And it kind of makes sense. Like, why would, why are we not talking about the microbiome of the uterus, just like we'd be talking about the microbiome of the gut? And how it could also be prone to dysbiosis just as much as, the gut would be. Also, women with endometriosis have higher rates of bacterial vaginosis. And so we know that they have some dysbiosis going on. And so I think we're very new in our understanding of endometriosis. I think like 10 years from now, I think my guess is that we're going to understand that infectious piece is a much bigger part than what we're giving it credit for now. And they've also found that treating what we call SIBO, which is a gut dysbiosis, actually impacts pain more than the typical treatment for endometriosis. So that right there tells you, oh my gosh, an antimicrobial impact is decreasing pain more than birth control, which is the standard. So I thought that was really interesting and definitely worth looking into. Interstitial cystitis is also something that is increasingly common.
Also known as painful bladder syndrome, kind of can mimic those like urge, burning, urination symptoms, frequency, having to go to the bathroom a lot.
Right. So in naturopathic medicine, we kind of think about, okay, for hyperpermeable guts, we call that leaky gut syndrome. Interstitial cystitis is kind of like leaky bladder syndrome because it's the same concept. There's a breakdown of the barrier of the basically the endothelial tissue in the lumen of the bladder. And when that breaks down, it actually causes
the glomerulation.
Yeah. So and the lesions, but also just systemic inflammation. And so it's not like there's necessarily urine leaking into the pelvic cavity, but inflammation is impacting that. I can't really do that justice necessarily. But one thing I will say is that the barrier that makes up that lining is influenced by chondroitin. So things that we traditionally use for arthritis are chondroitin and, oh gosh, what's the other one's name? Well, what I'll get at is they're both products that are really found from animal tissue. And so I think it'd be really interesting to do a study looking at whether or not vegetarians have higher rates of interstitial cystitis than meat eaters. That might be true, that might not be true, but it would kind of make sense. And so what we often recommend is doing a lot of bone broth, things we would actually do to support your gut, we actually will also recommend for interstitial.
They are best friends. The rectum and the bladder are so close. They're neighbors, so you have to really think about them both. And
Right.
from a PT's perspective, as far as IC is concerned, interstitial cystitis, we see a lot of, and you can imagine typically higher levels of that fight or flight sympathetic, kind of like anxious
Right.
presentation. How could you not? I had a gentleman who was working full time who had to pee. He counted one day, like 40 times in one day. And the norm is really like 6 to 10 max. So it was really affecting his work life, his sleep, because he was getting up in the middle of the night.
Yeah.
So we're finding a lot of tissue guarding, trigger points, tension, the inability to relax or to lengthen the pelvic floor coming from a musculoskeletal standpoint.
Yeah. No, and thank you for mentioning that men can get it too.
Yes.
Yeah, I think that that's often missed.
Yeah.
Pelvic congestion. Carly, can you say, well, how did you describe pelvic congestion on the pelvic floor?
Yep. So another action of the pelvic floor is to act as a sump pump. So when we talk about the lymph system, we think the big guys, we think your neck, your pits, and your hip, right in front of your hip. So the lymph is a very superficial network that kind of flushes out the bad stuff from far away from your body back to central so that everything can be cycled. And sometimes we get stuck. I can think off the top of my head of a very significant case of pelvic congestion that developed into what's called lipidemia, not lymphedema, but lymphedema. But it actually started from a traumatic sexual experience that led to this pelvic congestion, which led to this lipidemia, very swollen legs. So you can imagine if we have those lymph systems in the front of the hip filtering into the pelvic floor, if the pelvic floor muscles aren't doing that action, like even in the hospital, if you're in bed for a while, or if you're sitting for a while, if you're stagnant, we say just keep moving those ankles, pump your ankles, because the muscles have an action of also helping that lymph system and getting all the fluid throughout your body, your blood, your lymph. So this has the same, mechanism essentially. And then we also think about, like, are you able to move your pelvis? So the bony aspect, can the pelvis rock back and forth, side, rotate? It has to have that mobility. Are the muscles pumping? Is the lymph blocked? So we have our little sump pump in here to help filter all the fluid from far away in the body, the hands and feet, closer to the center parts of the body.
Right. I love that sump pump.
Sump pump.
Because it's true.
Yeah.
I'll say about the lymph too. So the lymph system is basically, if we have any sort of scar tissue or any sort of inflammation or anything like that, what happens is our white blood cells come from our arteries and our capillaries, and they go into that tissue, they clean it up. These little macrophages eat up anything that shouldn't be there. And then those macrophages, they don't go back into the veins, they go into the lymph system. And so the lymph then is this circulatory system that's supposed to go basically return that macrophage, after it gets processed back to the blood through the heart. But if the lymph is what we call kind of backed up, it's the very scientific.
Congested, sure.
Yeah.
Traffic jam.
Traffic jam. Then that macrophage has nowhere to go. And so it kind of stays in the tissue, and then it breaks down and actually causes more inflammation. So this is so important whenever it comes to actually taking down the inflammation in the pelvis. And I will say, not to harp on this topic, but it's just such a good one. I recently went to a lymphatic massage therapist, and it was amazing. First of all, felt amazing. But her feedback was really interesting, because she was able to say, look, your lymph in your pelvis is not draining very well. That was her feedback to me. And, now it's on my awareness that this is something that needs to be addressed more often. So since then, I've really upped my intake I take certain herbs that are really good for like lymph drainage, like cleavers is a really good herb for that. There are homeopathics that work really well. But other things that help with lymph drainage, besides exercise, which is probably the foremost one, is like taking baths and having that water pressure actually move that lymph up the system. And then also we have this thing called skin brushing. And so it's basically where you take a brush and you brush your skin from your toes up and your arms up. And that helps move lymph as well.
If you look on Amazon, it's like a skin brush. Like, don't just go using any comb or any anything for your hair. It's like very fine. But you told me about that. It feels so good because that lymph system is very superficial. It's very close to the top of the skin. So it should be very light touch. It should be very superficial. It's not deep tissue that we have to coax to get moving. Yeah.
Right. No, absolutely. And the last pointer we have on here, I didn't really touch on ovarian cystic ovaries. What I'm going to say about this is you pretty much have to look deeper. First of all, there's different reasons why people have cysts. Some people have PCOS. Some people just have a random cyst that happens. You have to go deeper, and you probably see somebody like a functional medicine doctor to really look at your hormones and also look at your overall inflammation. That can cause that too. But the last bullet point here, the mind uterine massage. So I didn't tell you the story last time, but I'll tell a story now. Mind uterine massage came from, in like the Mayan culture, they had practitioners whose sole focus was the uterus. And they would say, okay, well, if the uterus is tilted to the right, well, then the woman is going to have this disposition. If the woman is tilted to the front, they're going to have this disposition. A woman is centered and healthy and happy when the uterus is in proper position. And so, right, isn't just like an interesting concept?
Did you hear about this all the time? Retroverted uterus, or somebody will say, like, I think my partner's hitting a wall somewhere. Yeah, you can be tilted. It has mobility. That uterus can be, it's very individual.
So I would love some study to look at that one.
Yeah.
It never happened, but it'd be so cool. But so basically, mind uterine massage, I'm not going to demonstrate it for you, but you can go on this YouTube link or just type into YouTube mind uterine massage. There's tons of different examples of people who explain it. It's really simple, but it's like a self-care massage you can do to your abdomen that really helps people who have like any sort of whether it be just normal pelvic pain or pain with their periods or anything like that. Probably because it gets the lymph moving, honestly, but.
The lymph, the uterus, we think about the organ. We also think about the tissue in the skin. We got into this yesterday. I just want to touch on it.
Yeah.
As far as pelvic pain, I've had gentlemen especially, but I've had CrossFitters coming in who developed pelvic pain from really overdeveloped core and from really not stretching. So it's almost like that tissue in the front, the skin, the fascia, the lymph, the muscles, you name it. They get so tight in the front, something has to give, something has to compensate. So we find that the tightened muscles are weak, the lengthened muscles behind are weak, the tissue is all coaxing forward. And when the body is hugging either tightened tissues or scars and we don't have that mobility of those organs, we can have a lot of problems there. So sometimes I get these guys, or these women too, can develop pelvic pain from overdeveloped muscles. Just in my experience, it's been more so with my CrossFit guys. I don't know what happened. And I'll find trigger points in their abdomen, like in their rectus bellies. Their organs aren't moving. The tissue is just taut. So something to think about too, that we can develop that pelvic pain just from overcompensations. We talked about, you're like, well, talking about that deep core muscle, should we be sucking it in all day? And the answer is no, it's not functional. We don't need to contract that muscle all day. And how many of us were told growing up, and I grew up dancing ballet, and you did too, suck it in, stand up nice and tall. And if we develop that pattern and we make those tissues tight and we overuse those core muscles, we can develop that pelvic pain too. There could be musculoskeletal reasons behind it.
Right. And we could talk about this conversation for days too, because it is so hard to learn how to sit up straight, like
how to breathe properly.
It's like a full-time job to think, okay, is everything aligned? And for me, I thought that I was doing a good thing and a right thing by sucking my stomach in and to hold myself up so that my shoulders could relax, because I get so much shoulder tension. And then after maybe a week of like, I'm going to do this, I started really noticing more pelvic pain too.
Mm-hmm.
So it's like you can't win for losing.
They have to be appropriately strong and coordinated, but we can't have a favorite child. We can't favor the abdomen. How's the pelvic floor working? Are you breathing from your diaphragm? Are your spinal extensors in the back getting lazy?
Right.
Everything has to work in balance. It's like it's described as a Coke can, that deep core. So if one part is working too hard and the other one isn't, we start crushing that can, and we just want it to be nice and happy and have that cylindrical support.
Right. And
in players.
I need to come see you, obviously.
I think everyone should get a pelvic PT evaluation yearly, naturopath, psych eval. Let's do this.
We'd have a happy society. Anyway, so this gets into one of our last topics, and that is trauma. And that's because you can't talk about sexual pain or sexual discomfort unless you talk about trauma. So the first thing I want to kind of touch on is, I think everybody's heard of fight or flight. So fight or flight is whenever you are, if you were in a room and a tiger came out of nowhere, your hormones, everything would shift so that you could basically gear up really quickly and run away, right?
Survival mode.
Right, survival. And everybody, I think, like, it's pretty common to think, okay, are you in fight or flight or rest and digest? But one piece of the puzzle that's often forgotten about is freeze. And so in trauma, what often happens is, let's say there's some sort of fear triggering event. You go into that fight or flight, but for you to actually escape or fight would cause more danger to you ultimately. So as a result, you go into a freeze mode, which is an even deeper nervous system response. In animals, we see this where they actually will like pass out, some of them. Like this is whenever a deer jumps in front of a car and you wonder, why is it just freezing? Why is it not moving? And it's during the headlights. It's because of this like deep neurological response that safety sometimes comes from freezing and some level of dissociation. So for a lot of people who've had trauma, this is actually, they're more stuck in like a freeze mode. So they might be sympathetic and fight or flight in their everyday life, and then they go into a sexual experience and they go into a freeze mode. And so learning how to not dissociate is the most impactful and powerful thing for them. So like in cranial sacral therapy, this is something that I work with a lot, because some people, they'll come and to get work on them, and even if I touch their head, I can tell that their nervous system goes up. So, some people will go and they'll lay on the table and you touch them and they're just like, oh, touch me more, like they love that touch. And some people, you touch them and they immediately get anxious. And so learning to distinguish, okay, which mode you might be in is really helpful in learning how to address it, I think. And so for those patients, I'll often start with, okay, we need to develop trust. We need to develop safety before I can even touch you. I might start working on their hands or a place that does feel safe to them or acceptable to them. And I have to be very aware as a practitioner to notice, oh, they're dissociating. And sometimes people don't even have awareness they're dissociating. But if you have an eye for it, you can kind of tell when people are going into that mode. And then you have to basically stop touching them and talk to them again and say, and reestablish that safety. And it's a process. And for, I've had people who I worked with for, quite some time, maybe 6 months, and we make a ton of progress. And then they're having a particularly bad week, and they go right back to where they started. So it's a process, but people, whenever they do learn how to stop dissociating, I think it's very rewarding. I will say, and not to harp on this topic too much, but if you've lived a lifetime of dissociation and then all of a sudden you start tuning back in, you're like, ugh, I have so many emotions, I don't know what to do.
It's overwhelming, right?
So overwhelming. And so then that makes you want to jump out of your skin even more. And so it almost has to be like this gradual reconnection. And I will, okay, not to go completely off topic.
You're good.
But people who have dysautonomia, so that's whenever they, let's say, might have temperature regulation issues, or they might, if they stand up too quickly, they pass out or they black out. So your nervous system is not able to regulate your basic function as well as it should. Often they have this dissociation. And so I actually, just to share, used to have really bad POTS, which is postural orthostatic hypotension, which is—
you stand up too quick and your cardiovascular system can't catch up. So it's literally almost like the blood rushes from your head, your blood pressure drops, and you just feel really dizzy and faint.
Right, and you pass out. And I did a lot of work to repair that, but the main thing I did was go from a dissociated state to a very associated state. Now I feel everything. And that's another thing. A lot of people who are in that state are because they're very sensitive to begin with. So I think that's really important. And the other thing I'll just mention about that is we really can't pick and choose what we feel. If we have a negative emotion that we are choosing not to feel, everything else is going to be numb as well. And so you either kind of have to feel it all or feel nothing at all. And maybe some people would disagree with me, but in general, feeling, well, there's ways you can modulate it so you don't get overwhelmed by feeling it all. You have to basically be able to learn how to sit in that. But that's a lifelong process. But I thought I would— do you have any questions on that?
I have a lot of points I want to bring up. So in talking about, you're working with this patient, you're starting craniosacral, and you just put your hand on their head and their anxiety starts going up and their fight or flight sympathetic nervous system starts ramping up. That's right. And given you have to build rapport with your patient, maybe they're not comfortable with it. Some people truly hate being touched. Yeah. And it's a non-painful, it's a non-threatening stimulus that's getting them into this system, into that fight or flight, running from a bear. So we have to think about that. I also want to link, and I think I might be jumping ahead, so stop me if I am, but I also want to link the fight or flight sympathetic running from a bear to your pelvic floor. A bear comes behind me and I have to sprint and run. Do I have time to go to the bathroom? Absolutely not. So my body, to get me running from that bear, it's going to make my heart pump, 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 and it's going to close my sphincters. So if I'm constantly in this fight or flight mode, my pelvic floor is squeezing like crazy and I'm building those trigger points and I'm tightening. So you can see how that feeds into that overtoned guarding trigger point posture. We know when we breathe from the diaphragm, like we're born breathing, innately breathing, that it kind of gets us into that relaxed parasympathetic, chilling at the beach, no threats to the body mindset. When we start breathing from the traps, same thing. I'm running from that bear and I don't care. I just need to get air in. I'm going to lift that rib cage and do everything I can and use all those accessory muscles to get air in so that I can run. There was a study where they had people watch a scary movie, and you know what happens when somebody scares you or you see a scary part of the movie, you shrug like that. So they put electrodes on people's traps, and also they had electrodes in the pelvic floor to see if they were firing up. And what they found is when people shrugged up like this, they also contracted their pelvic floor. And if you think about it, at the end of the day, we are lizard brains. We are cave men and women. What are the two most important parts of your body? Your brain, your nervous system, your spinal cord, your neck, your head, right? The moneymaker, and your genitals, your reproductive system, your sexual function. So we are protecting our neck and our brain and our reproductive system and our genitals. So there's a huge relation. Often patients with pelvic floor dysfunction and tightness, they also have a lot of neck pain and tightness. Maybe they're sitting at their desk during the day and when you catch yourself here and you're like, holy smokes, like what am I doing? Or these are the patients that are waking up in the morning and they've been clenching their jaw all night and they have a lot of TMJ issues.
And I'm sure it all feeds into everything because, if their core is weak, their shoulders are going to also take over, and it's just this really hard cycle to get on top of, I would say.
Yeah.
Which is
And
why I help with the physical therapist.
yes. And then I attached at the bottom. So she's like the pelvic floor goddess. She teaches, she has a private practice out in Portland, Oregon. Her name's Nari Clemens. And she has a meditation, like a guided meditation for pelvic health on Apple Music. And one of my favorite ones that I'll either refer to patients is, it's a body scan. So you can just lay there and see and feel and pay attention to different parts of your body and see where you're holding that tension and then try and let it go. There's another track called Full Body Relaxation where you can acknowledge it, try and relax it, try and let it go. And then the only other thing I wanted to touch on when we were talking about dissociation.
Yeah.
So sometimes we don't think something is traumatic, right? So for example, one of them is birth. I see a lot of moms, I see a lot of postpartum population. Yeah. And no matter what, if your birth plan went perfectly, you had a great delivery, you didn't tear, not too much pain, you're so happy, baby's great. Maybe it didn't go that way. You had an emergency, something happened, it was really painful, it took a long time, didn't go as expected. No matter what, it's a trauma to the body, something happened, it's stretched. Of course we can recover from it. But I see often with C-section, and if you think about it, sometimes it's planned, great, and sometimes it's an emergent situation, yeah. And there's a lot of trauma within that C-section. I mobilize it because, like we talked about, the body likes to hug scars. It can create restriction as far as how those organs are moving. I always do C-section scars. I don't care how old it is. We have to work into it and move it. And same thing when you touch that patient's head and you start feeling that anxiety, I can just lightly touch it and they're like, ooh, we avoid our scars. We avoid that scar tissue, and addressing it and desensitizing it and acknowledging it, look at it, feel it, get different materials on it, cotton swabs, any sort of paper, towels, anything to acknowledge it and dissociate it, we are so much better off. Normal tissue does not hurt anywhere in the body.
I love that. And I love just even that visual, right? Like we avoid our scars. We avoid our scars physically. We avoid our scars emotionally a lot of the time. And often we have to look at them and address them. Also on that same point, I mentioned this earlier. I think, so trauma happens anytime that your brain says yes and your body says no. So a lot of people who don't necessarily have an incident where they may have, had a sexual trauma, will still hold the same pattern as rape or other sexual traumas. And this gets confusing to them, but I think that it's very common that we're not able to assess what our body actually wants. And so because our brain might be saying one thing and our body another, our body will respond like it's a trauma, even if our brain doesn't. So I just want to kind of mention that, and that gets into a much bigger story of that we need much better education around sex and consent and even just like self-awareness than we have right now. And I have not checked out that relaxation meditation you have at the bottom.
Oh, good. But I think it's called body scan, and it's just your eyeballs. Like, are you squinting? Are you furrowing your brows? Are you squeezing your bum, your pelvic floor? Are you clenching your jaw? Yeah. How do your ears feel? How do your toes feel? Things we never really tap into. I love it. It's so good.
So good. You wanna?
Yeah, so I totally did jump ahead. So we touched on this, the relationship between the traps, the TMJ, the pelvic floor, general tension, posture, how we're breathing, and how that can affect pain and function. Mm-hmm. The fact that when we have anything in the body that shouldn't be there. So somebody has a joint replacement, somebody has a hysterectomy, somebody has a baby, somebody has new sutures and new scars, or an active infection or disease, the body is like, this is something that shouldn't be there normally. So I'm going to protect the body and I'm going to guard and I'm going to be tight. So if we have a patient who has had recurrent UTIs or is still suffering for them, or any other disease processes, sometimes those recurrent infections makes our muscles, and not only in the pelvic floor, sometimes we have tension here, anywhere else that I mentioned earlier, but that pain, that discomfort can lead us to be in this guarding position. So it's a balance of, okay, we have to address the active infection, but then we also have to address how the muscles responded to that foreign, irritating substance or problem that was there, so that we're back to our resting state and we're not constantly in that, oh my gosh, it hurts to pee, it itches down there, I'm going to squeeze like heck, because we do build those habits, which is super common when things don't feel so good. We talked about how I've seen patients who, in the absence of an infection, are getting these recurrent antibiotics. It happens. We build that resistance. You can talk better to that than I could, but we have these recurrent antibiotics without the disease process. It gives them that short-term relief, but it's not the solution. And sometimes I'm treating someone who's had these recurrent UTIs, and they've same gentleman who was peeing 40 times a day. And he's like, I've had 6 rounds of antibiotics in the last year. They helped me for a week, and then everything starts back up. We look at it from your standpoint where we're wiping out all of that good bacteria, but then we also think about it, the longer that we delay and the longer that we are not addressing the infection from a medical standpoint, the longer those tissues are guarding and are building trigger points and are just learning their new norm of, I just have to squeeze because it burns when I pee and it itches and it hurts. Right. We talked about the fight or flight, how breathing from the traps is running away from a bear that's sympathetic. Everything's clenching. We just got to go, survival mode. And how breathing from the diaphragm is that relaxed at the beach, parasympathetic state, that allows our pelvic floor to get some stretch and to move and to relax. So when and I know you're the same way, you get a patient in there and we ask a lot of questions, your lifestyle, your diet, your stress levels, your bowel bladder habits, your posture, how the spine's moving, what you do for work. There's so much that goes into the picture that, it's not just, oh, Carly looks at the muscles and the bones and Erin's looking at the bacteria and the blood levels and the hormone levels. Everyone, we have to look at these individuals from a bigger picture, because I really strong believer that everything in the body is connected.
Right. On a mental and emotional and spiritual and physical.
Yes. Thank you. I left that
Everything it plays into each other.
Yeah. My brother, side story. So I'm from the tri-state area. My brother has been working for a big financial firm in the city. He does 15, 16-hour days. And I'm like, I'm not going to do it, but you need to get your pelvic floor assessed, because you are probably you work like a dog, 16-hour days, high stress. You're probably clenching. I said, you and all of your buddies need a pelvic floor PT because you're going to hurt yourselves.
Oh my gosh. I can only imagine your brother's response.
Oh gosh.
Your brother's like, what, 6'5", and he's like ex-military. He's a stud.
Yeah. Military too, Yeah.
But yeah, so interesting. So normally we would have questions if this was live, but as we said, our live one yesterday was not recorded.
What?
Remember any of the questions we had from yesterday that we could even repeat?
Something that was brought up, 2 things that I left out. So when we talk about the pelvic pain and insertional pain. So this isn't always, it doesn't have to be a woman who's sexually active. It doesn't have to be penis and vagina. It can be different partners, toys. But we also have to think about if they want to use a tampon during menses, can they get a tampon in? Can you tolerate the duckbill archaic torture device that is the speculum to get your annual swab? They need to come up with something better, because that's the worst. So we think about the speculum, tampons, toys, fingers, penises. And what exists is a dilator set, and it's kind of like a graded, think of it as like a medical dildo set, and you start really small and you work your way up to kind of acclimate those tissues to create space. So sometimes I'll recommend that patients get a dilator set, and some of them are like less than $20. And then also, one of our participants mentioned that she has a pelvic wand. So there's one that I'm thinking of in particular, and it's S-shaped to give you some leverage, and you can get in there yourself and explore those muscles and see and treat any trigger points that you may have or restrictions. So the pelvic wand is great. so that you can do your own internal work and treat yourself, along with stretches and breathing, product training.
So I would say that more trigger points are more common in the vagina than people could ever realize. And I think that whenever you start doing that work, it really, one, makes you feel comfortable overall. Like when you're sitting, you notice a difference. But as far as like sex life goes, it can be a game changer, even if you don't even think you have a problem. It helps, like you can achieve orgasm easier, and that kind of stuff. So I would almost recommend that to any woman, because doesn't have to be a sexual thing. This is just like, okay, just like you might work on a muscle and roll out a muscle in your back if it was tight, let's talk about the vagina and do the same thing in there. The other thing, were you finished? I didn't mean to interrupt you.
I was just going to say, it's very intimate work. Pelvic floor PT, you guys get close, and rightfully so, because you don't explore that really with a lot of people.
Right.
Back to the trauma slide, sometimes patients are telling me about past traumas, and unless they've been to a psychologist or have sought out help, I might be the first person that they're talking about this with.
Right.
So we have to take that into consideration. And it is kind of intimidating to go into a physical therapy appointment and you're in a private treatment room and you're like, okay, time to strip down. Let's see how those muscles are doing. It can be very intimidating. With that being said, if you go and you're not comfortable, there's so much that we can work with and you can build up that comfort level. But also with that being said, like, we need to empower like our women to feel more comfortable treating this and addressing this. And the fact that pelvic floor PT sometimes has this great side effect of increasing sexual pleasure, because finally we're addressing these trigger points. We're learning how to relax the pelvic floor, because an orgasm, some women are just like, and the orgasm is a very complicated thing. There's a lot of emotional and psychological aspects that come into it. But from a musculoskeletal standpoint, it's that gradual tension, squeezing, followed by that big release. So you can imagine if you don't have that range of motion, it's hard to achieve orgasm. Had a patient comes in after her second baby, she goes, Carly, is it strange that she was like, she's like, I like sex and it's fun. She goes, but I've never truly had an orgasm until coming to pelvic floor PT. And I'm like, she's gone through 2 births, but addressing the soft tissue restrictions and restoring that range of motion in the bowl of muscles
that is honestly
really made the difference for her.
That was not something that was on my radar before you mentioned that it's like, yes, orgasm is the muscles are contracting, and then there's a big release.
And what if they can't release?
Have mobility in those tissues, and if you don't, you might not be able to achieve orgasm. Like, we're
going to have some great conversations, especially coming into the pregnancy segment. I talk a lot about birth prep, the postpartum period. I teach women how to prepare for childbirth by teaching them how to poop appropriately. Get yourself in the right position. Use your breath to your advantage. Don't hold your breath. Big problem that we have, my CrossFitters, my weightlifters, maybe my moms with toddlers who are always hiking them up and schlepping stuff around. When you're holding your breath, it's too much pressure into your intrathoracic and intra-abdominal area that cave woman brain is going to clench up your pelvic floor to keep your organs from falling out, really. So when we learn how to use our breath to our advantage and fire those deep core muscles and lift with intention and lift appropriately to protect our back, our pelvic floor, our whole, all of our organs there, we do much better. It drives me nuts when women come in and they're like, I was just told to hold my breath and bear down. And I'm like, no, we can't hold our breath to poop or have a baby because you're actually contracting. So baby or feces are trying to come out of a kinked hose. So we need to learn how to bear down and relax, and you're allowed to exhale. You gotta exhale.
You gotta exhale.
Yeah.
I have one more point on that. First of all, that dissociation piece that I experience, you probably experience a lot with patients. Because that's so vulnerable down there. I think that there's such value in having someone touch you in a really vulnerable place in a non-sexual way, right?
In a safe way, in a comfortable way.
Comfortable, non-sexual way. And that's, I think, the first step a lot of times for people, because I mean, there's so many women, unfortunately, that basically bear and grit and get through it rather than fully being able to enjoy it. And so I think there's so much
patient in college, and this was so mind-blowing to me because we had had a conversation about the physical aspect and the mental aspect, and obviously they're so related. But if I evaluate someone and they're like, I'm having painful sex, and I mean, my finger is much smaller than a penis, right? It's not thick. It might not be, it depends. But if I'm in there and I don't find any tenderness, any trigger points, they're not jumping off the table, nothing's eliciting pain, then yeah, maybe it's more so a connection. Maybe it's more so a mental aspect. Had a young patient in college, lovely girl, in a safe relationship, no history of trauma, and she goes, sex just, it hurts, right? So I would get one knuckle. So we have 3 layers. I didn't even get into this. We have 3 layers to the pelvic floor. So we just go knuckle by knuckle. Pelvic floor therapists are cats in a bag. We treat muscles, right, that we can't see. But we have our landmarks. We do what we have to do. I was right at the entrance of the vagina, and she's like, oh my gosh, it hurts so bad. She's jumping. And obviously we don't want to elicit pain. We're also desensitizing those tissues and working to lengthen them. So we were having a discussion one day, and she's like, you know what? I still have sex with my boyfriend and it hurts really bad, but I just grin and bear it. So, the fact that she was able to do that, and upon my examination, I'm like, I don't even know how you're tolerating it. She was like, I know, I just kind of grin and bear through it. And we had a lot of good conversations about intimacy and the fact that while you are healing and while you are getting treated, in order to, we don't want you to decline and go back to where you were. So in the meantime, sex isn't always penetrative. So we can explore different ways to have intimate relationships, and experience our bodies and have foreplay and have fun with our partner and express our feelings and our love without that penetrative aspect, just while you're healing up. And I think there's also something to be said for the male orgasm has a very clear ending. The female orgasm is way more complex, and we just have to understand that we can achieve it, that we have the right to achieve it, and that we just have to look at it from from all angles.
Yeah, absolutely. I think, we could probably talk for like another 3 hours on this topic because
we always do this.
We do. Like, this is, we're just giving you a little insight into our phone conversations. But this world, I think that there's so much education to be done around sex, about having like proper, like, not to get like too spiritual, but like becoming one with a partner. I mean, ultimately that's kind of the highest level of achievement, if that's what you kind of a way to think about it. And we as a society, like, our education for sex is porn, which is so far from the reality of what sex is supposed to be, at least from my biased opinion. And so I think that, there's a lot of education to be done. Meanwhile, there's people like you who are there to help kind of fill those gaps for people, and people like me also who are good at
and you, please.
Do some detective work, because that's really what we're here to do.
Yeah.
And I'll segue that into our next, because we're doing 3 different series here, 3 different webinars. And 2 weeks from now, we're doing one on preconception and pregnancy. So Carly, if you want to talk about what you'll be talking about then.
Yes. Pregnancy, we're going to talk through the postural changes. What happens to your body? What happens to your muscles? How do we prepare for birth? How do we decrease the risk of tearing and the need for episiotomy? What's normal labor versus, I shouldn't say normal, but like what's safe labor as far as time? Because we know if you're pushing for 4 or 5 hours, that's a lot of downward pressure. We talk about common symptoms that arise, maybe a diastasis or a split of those rectus bellies, a lot of dribbling, right? Stress incontinence, you sneeze and you dribble a little bit. My mom has got a little bit of a pass, but not too much. Exercise, what's appropriate. Some women are super active, they become pregnant and they're nervous to continue their exercise programs. So talking about that. Preconception, I want to call the guys out a little bit, because I know that the woman usually carries the onus if in a male-female relationship, if you're having a hard time getting pregnant, the women usually take it on. There are superficial pelvic floor muscles in the male anatomy that help propel the sperm that have to be nice and strong that can contribute to infertility. So we're going to talk about that a little bit as well.
Ooh, that's.
And then what are you going to be talking about?
I didn't know that aspect of men, so I can't wait to hear about that. So I'm going to be talking mainly about preconception and how to prepare your body for pregnancy. Most cultures across the world have a period of preparation, and unfortunately that's been lost a lot in Western culture. But it's hugely important for the health of the fetus and the mom to like have a smooth pregnancy. So that I'll probably be talking a little bit less about pregnancy, but maybe just, different ways you can support yourself as far as morning sickness and that kind of stuff. So
that's amazing. That's so great. And
yeah,
like what supplements to be taking that are safe during pregnancy.
Yeah, what herbs are yes, what herbs are no.
Hormonal changes, the whole schmagiggy. And then at the end here, we just have our contact information. If you have any questions, comments, concerns, always our emails are on there, our websites are on there.
And we didn't actually really say, like, I work at Turnpile Health and Wellness, that's in Central Pennsylvania, and Carly works at...
I am in Northern Bergen County, and my company is Empowered Pelvic Health, and right now I'm doing telehealth, and I'm debating when to go back into what I was doing, but I do concierge services, which means I come to mom, I bring a treatment table, I bring all of the goods, because I found that a lot of my moms in typical private outpatient were unable to come, or they were super late, and it was just kind of, it was causing a strain. Women are busy, so I just wanted to make it super convenient. Had a mom of 6. I saw her after her 6th baby. I said, let me know if you become pregnant because there's certain things I can't do. She laughed in my face. 3 months later, Carly, I'm pregnant. Saw her through pregnancy number 7, postpartum number 7. And she's one that had a hard time coming in because of childcare. So I was like, well, how great would it be if I brought it to her and the kids are in their environment, watch the TV for an hour, go zone out, let mom do her thing. So yeah, sorry, went on a tangent, but.
Oh, great. Thank you for joining us. If you made it the whole way to the end, thank you. And in 1-2 weeks. Okay,
I want to say one more thing.
Yes, what's up?
At the bottom, I put a website of pelvic floor physical therapy. It's a directory of pelvic floor physical therapists that have done training through the Herman and Wallace Institute. Sometimes it's hard for patients to find a therapist near them. So it's pelvicrehab.com, put in your zip code, that's it. Just so you have that resource. And then, like we said, you can reach out with any questions. Our emails are there. And if we can't help you, we can get you to hopefully the providers that can.
Yes. All right.
Thanks, guys.
Bye.
See you in a couple weeks.
Yeah.
Thanks, Erin.
Okay, wait. I'm not done yet. I'm just making sure we're still recording. Yes, we are recording. Thank goodness. Okay. But now I'm still recording.
Mild technical difficulties. At least we recorded this one.
Okay. All right. I'm done.